everyone, it's me again. I'm Lena and I'm from the Healthcare Landscape Group. In this video, I'm going to be talking about my main video, which is on the topic of key aspects of volumes and solutions in patient care. Now, in this video, I'll be talking about what are volumes in solutions in patient care, what are some of the key aspects of volume in solutions in patient care, and also some of the key types of volumes in solutions. So let's get started on the first part, which is what are volumes in solutions in patient care? Well, volumes in solutions are basically what it sounds like. These are volumes or precise measurements and amounts of IV fluids, such as medications or amounts of fluids, electrolytes, or medications administered to a patient. And in this video, I'll be talking again about the 5 main aspects of volume in solutions, and also I'll be informing you of the 5 key types of volumes in solutions. So moving on to the next part, the key aspects of volumes in solutions. The first one is resuscitation. So basically resuscitation is, its main goal is to restore blood pressure, and also it will help to restore tissue perfusion by restoring blood pressure. Now, it is used for patients which are experiencing shock or trauma or severe dehydration. For example, a patient with septic shock may be administered an amount of IV fluid or in septic shock with a blood pressure of 80 over 40 millimeters of mercury, is given a rapid infusion of isotonic crystalloid, which such as 0.9% normal saline. So this will in turn help to increase the blood pressure as well as the cardiac output. So that is one example of resuscitation. That is the first aspect. The next one is replacement. So replacement is just replacing fluid that are lost. For example, when I am vomiting, when my child patient is vomiting, or when they are bleeding, or through diarrhea and other ways as well. So IV fluids and other kinds of fluids and solutions will help to replace the fluid loss in the body. So, for example, IV fluids are administered to a patient with severe vomiting, severe bleeding, and also experiencing diarrhea. Now, the total replacement of volume and infusion rate is based on the patient's condition. It is based on the patient's weight, their age, and their body, their status, as well as their condition. Is it severe or not, or is it just mild? So those are the examples for the second aspect of replacement. So the first one is resuscitation, which is restore blood pressure. The second one is replacement. So this is replacing fluid losses. The third one is maintenance. So maintenance is basically daily hydration. So it is hydration for the patient who cannot hydrate orally. So for example, a patient who can't drink, or a patient or an NPO patient, or a patient nothing by mouth. NPO is nothing by mouth. Patient is giving IV fluids such as 5% dextrose and 0.45% normal saline. So given this amount based on their condition and their status, it will help them to maintain hydration and electrolyte balance. So maintenance will help them to be hydrated even though they can't drink. So IV fluids, it's one of the main purpose of IV fluids. The fourth aspect is medication concentration. So medication concentration is, and diluting is actually diluting the medication based on the amount given, and diluting the medication can dictate how fast it can be administered throughout the body. Now, for example, if we are preparing 1 to 10 dilution, for example, 1 milliliter will be added to 9 milliliters of normal saline, for example, and then we will have a 10 milliliter total volume. So that is an example of medication concentration. We mix this amount with this amount to get the dilution, so it wouldn't be as strong or it wouldn't be as dangerous. Now, rate precision. This is the last aspect. So I've talked about this before in my last video about rate precision, and it's just basically the 4-to-1 rule. Now, the 4-to-1 rule is a rule that helps to calculate the hourly IV maintenance fluid rates. So this is exactly what it is. The 4-to-1 rule is part of the rate precision. So rate precision is volume over time. What do I mean here? Well, volume over time is the speed that solutions are delivered. So this is milliliters over hour. Milliliters over hour. So let's review for the 4-to-1 rule with an example. Now, let's say I have a 15 kilogram child patient and I want to find his amount of IV fluid, the amount of IV fluids that I need to administer to my patient. So for the first step, I need to find the first 10 kilograms. So I will take 10 times 4 equals 40 milliliters per hour. So this is the first 10 kilograms, but we still have another 5 kilograms remaining. So this we will take 5 times 2. This will equal 10 milliliters per hour. Now to find the total amount, we will just need to take 40 plus 10, and then we will get 50 milliliters per hour. So my result is that I will need to administer 50 milliliters of IV fluid to the patient per hour. So that is for the fifth one, the key aspects of volume in solutions in patient care. Finally, the last part, I'll be talking and discussing on the key types of volumes in solutions. So there are 5 main parts as well. There will be the crystalloid solutions, which are just solutions carrying sodium chloride or other electrolytes, for example 0.9% normal saline and lactated ringers. The second one is colloid solutions, and this will contain larger insoluble things in there, and there will be containing larger insoluble molecules than the crystalloid solutions. For example, some of that will be starches. So they will all be used for IV fluids and for that purpose. Balanced salt solutions are solutions designed to match plasma composition, while small volume infusions are used for medication administration, usually from 50 milliliters to 150 to 250 milliliters. So this is small volume infusions. How about large volume infusions? So, well, this will be between 500 milliliters to 1,000 milliliters or 1 liter of IV fluid. So that will be 500 milliliters to 1 liter bags of IV fluid, and it is used for resuscitation and rehydration. Now, in conclusion, to conclude about the key types of volumes in solutions, firstly, the crystalloid solutions are used for fluid resuscitation. Colloid solutions are primarily used for maintenance, and it is used for being in IV fluid as well. Balanced salt solutions for IV resuscitation. Large and small volume infusions are for resuscitation and rehydration. So those are all the things for the key types of volumes in solutions. In my DE2, I will discuss about the difference between the crystalloid solutions and colloid solutions, which are the 2 main types of IV fluids that doctors and nurses alike typically use in their practice. So I will be discussing the difference between those 2. But anyways, those are all the things that I have to say for my video this week. If you have any other questions or any other suggestions for improvement, please let me know. Thank you again for listening to my video, and I'm looking forward to see you soon next week. Goodbye!